Hello and welcome to Around the Clock. On today's show, we are going to be speaking again with Adam Benson from Healthcare Technology. Adam, welcome back to Around the Clock.
Thanks for having me.
So Adam, when we spoke to you last, you were getting ready to have some shipments of some PPE equipment, and you also have some other projects going on in your company. Why don't you talk to us first about the equipment that you were expecting and if you got it and if you were able to get it out the door?
I think last time we spoke, we were in the process of bringing in three-ply masks, procedural masks. We were able to get our first shipment in of 250,000, ship them out to the hospitals and non-acute care facilities that we manage in the Northeast and Mid-Atlantic last week. We're still waiting for the second shipment. It's been at the airport for over a week now, but they're just every day we're hearing of increased delays just because international markets are getting inundated with other organizations trying to get supplies out. And we're doing everything we can to get it in as fast as we can, but unfortunately these things are out of our control at this point.
And is that in an airport where it's being shipped from or where it's arriving at?
Shipped from.
Okay.
Yeah.
Okay. So you also have you talked to us about some expansions that you're working on through this whole thing for your business. Can you talk a little bit more about that?
Sure. Yeah. So we're in a condo building that has multiple warehouses and front office space. I believe there's 8 or 9 units in the building that we're in. And we actually have been operating out of 2 units that have been combined into one for over 10 years. Just recently, our neighbor, who has approximately 10,000 square feet, has moved out and he's brought his business to another town. And we worked out a deal where we were able to take over his space. We actually got the keys last week, and we increased our capacity by 10,000 square feet, which is about 50% of additional warehouse space, giving us much needed room to handle the growth we were experiencing before COVID, but also with this, it's worked out really well for us.
So what kind of, you've expanded by 10,000 feet. So what kind of growth are you looking at in regards to that space?
Our company was growing about 55% going into this year before this crisis hit. Now, the task I have is to get a better understanding of what the market is going to look like after COVID-19.
Mm-hmm.
I don't know. I don't think anybody knows,
Right.
but I'm doing the best that I can based on the trends I was seeing before, and just trying to get as good of an understanding of what the hospital systems are doing and what their needs are to plan accordingly so that we can ensure our partnership with them and supply them the necessary products that, they've come to rely on from our organization.
Now, well, your business, you just said you're still doing some research. So when we spoke to you last time, you spoke how your original plan and your original business was specific to pharmacies and the work that pharmacies do. You then expanded to just the whole hospital because of the need for the PPE. Will you continue working in the whole hospital, or will you still go back to just being focused on pharmaceutical and pharmacy needs?
Yeah. So our model, we have what we call our 3 pillars of focus. Our fastest growing market segment is the pharmacy space, but we also carry a vascular access portfolio and an airway management portfolio that puts us in a lot of the different areas of the hospital. So we are well versed in those areas. The biggest change that's transpired is many of the PPE products that we sell in the pharmacy have, found their way into the regular hospital. We don't intend to continue to do that, as our products that we sell are specialized, specific for pharmacies and compounding pharmacies. So yeah, I don't really see that being a direction that our organization is going to head in, but some of the other products that we sell, whether it's in respiratory, anesthesia, or vascular access, those products will continue to support in the rest of the hospital.
Great, great. So you had mentioned last that you weren't bringing other people in. Is your staff still healthy and coming in, and everybody's still okay? Figure we should check on that.
Yes. Thank goodness. Yes. So we're doing very well with that. We've implemented the strict protocols, as you indicated, not letting anybody in. Everybody is wearing masks. Everybody is social distancing. Fortunately, we have enough space here where all of our offices are spread out, and we can work independent of one another. The only area that becomes challenging at times is back in the warehouse, but we have all the hand sanitizers and masks that we need here to ensure that everybody feels comfortable and can, continue to keep as safe of an environment as we can under the circumstances.
Great. Well, Adam, thank you for the update. And if anything changes, or if you feel that there's more information that we should share with our viewers, please make sure you reach out to us and we can get back on the phone with you again. Keep doing what you're doing. Thank you for what you're doing. Stay safe. Any last thoughts you'd like to share on what you're doing that would be good for our viewers to see or hear?
Yeah, I think that the biggest thing that, I would just share is that, there's a lot of people out there that are working diligently to get us through this crisis. And, we're going to prevail because the people on the front lines, not companies like mine, we're doing our small part, but the people in the hospitals, are really working day in and day out to try and get us through this. And we're going to get beyond this. And I just think that everybody needs to take the time to reflect on life, but know that, better days are ahead.
Okay. Well, that's good advice. Better days are definitely ahead.
Yes, absolutely.
Well, Adam, thanks again. Stay safe, stay healthy, and thanks for doing what you do.
Yeah, absolutely. Thanks for having me again. Bye-bye.
You're welcome. We'll be back with more Around the Clock.